So again, if you think about boxing, one of the most common injuries you're going to get, and that's been researched, obviously we've actually done a lot of research ourselves, are knuckles, especially these two knuckles. So a lot of times what happens with them, they actually tear the ligaments over here. So the problem with that is they will struggle to compete. Now, easily you could say yes, send them for an operation and repair it, but that takes about 4 to 5 months. So what we found is sometimes is actually by managing the pain, you can actually get them to train and then compete and keep them going. So one of the things I found really good, so you've got ligaments on both sides, and they call them the sagittal bands, and together it becomes like an extensor hood, which keeps the ligament, the tendon in the middle intact. So just by using that, and just probably can feel the ligament there. And really all I'm doing here is, because again sometimes people ask me, so what are you doing? Are you trying to heal the ligaments? Well, you can't really heal it, it's probably damaged. Potentially can help the scar tissue. But the main thing I find is desensitize the area. So what will happen is in the beginning there'll be pain and they'll be like, oh, I can feel that. And you know you're on the right spot and you can feel it a lot of times because it'll be feeling gritty. But all you're doing there is, as they will say, you're numbing it. And you get to a point where now I can't feel it anymore, and you just keep going around and you find the spots and you get to a point completely pain-free. And I find that's really good. Obviously in the acute stages, you want to treat it as an injury pathology, so you can use that as part of the treatment modalities to improve things if possible. But if somebody's struggling to box, maybe you're making them better after treatment and then you want them to box and they're finding that, yeah, it's better after treatment, but then they're struggling to hit still. I've found that actually doing this before they start hitting, so before they actually have rubbed their hands, it's made a massive difference. Something like this is something, again, I'll be discussing in the course, because we talk about the knuckle. I've seen other areas like medial stress syndrome for runners on the tibia and the other areas.